It's been 3 years since Governor Brian Kemp declared a public health state of emergency in Georgia. Hannah Latier spoke with local businesses and medical centers about what's changed since then.
During Governor Kemp's televised address on March 14th of 2020, there were 64 cases of COVID-19 in Georgia.
I think looking in retrospect, there's a lot to celebrate. There's a lot that we got right, particularly in Georgia.
As of March 8th of this year, the Georgia Department of Public Health says there has been more than 2.3 million confirmed cases in the state. Over 100,000 are in Richmond and Columbia counties.
Our leadership very early on understood the pandemic and what the possibilities were, both on the university side as well as on the health system side, and put the appropriate support behind being prepared very early on in the pandemic.
However, some days were bleak.
We had lots of days where we felt that that was going to be the worst it ever got, and only for the next day, unfortunately, to get worse. So the team responded incredibly well. We pulled together as a community.
Dr. Kuhl credits vaccines for creating a turning point over the years.
That certainly dramatically reduced the impact of this disease, particularly for those that are most vulnerable, and also for the healthcare providers who were literally risking their life taking care of patients with COVID.
But we're not out of the woods yet.
We're still just kind of one mutation away from this thing coming back and becoming more severe. So nobody should think that because of some date on the calendar that this thing is just magically over.
However, we are making progress every day.
We've really moved toward that step of this becoming part of an endemic disease, and that is one that just exists in our society.
Dr. Kuhl tells me that many people missed primary care checkups over the past 3 years, and it's important to start keeping up with those again.